and on the other one, so share this one. Is it sharing? I don't think it's sharing. Can you guys see the PowerPoint? Why is it? Oh, there we go. There it is. How's that? I think that's where we left off, right? On that particular one, we talked about reticulocytes.
Miss Regalia.
Yeah.
Your connection has lagged a couple times for a couple of us, so we might ask you to mute yourself.
Okay, that's fine. That's fine. I'm sorry.
No, it's okay. We just wanted to let you know.
Thank you. Okay. Is this where we left off, or I can't remember? We looked at Heinz bodies, right? We looked at reticulocytes.
Yeah, that's where we left off.
Okay. So we looked at that picture. Let me pop this up bigger. Like so. All right. So this one, there'll be a couple IDs from this one about the parasites that they can live either on the surface or within the red blood cells. So the biggest problem with blood parasites is sometimes misstaining can actually make them look like parasites, but it's actually an artifact. So if you let your blood slide dry standing up, it may appear as a parasite because it's kind of just pooled the stain into one position. So whenever you're looking for parasites, if you suspect them, always make sure you're using the appropriate stain, drying it appropriately, that sort of thing, so you can see the cells much better. So the first one is Babesia. So Babesia, let me get my little text thing going here. These are paired inclusions, so they kind of transmitted via ticks. They kind of duplicate themselves. So it's like a mirror image. You get it, and then it duplicates and duplicates and duplicates. And what this is going to do is it's going to just destroy the blood. So you're going to get hemolytic anemia when the animal has Babesia. And you're only looking in the feathered edge of the smear when you're looking at these particular ones, because the stain tends to pool. The further in you get, more stacked the blood vessels or blood cells get. And lots of species get it. So your domestic animals, dogs, cats, you can see it in large animals. So we always like to recommend that they have some sort of tick prevention, or they're on some sort of regimen where they don't get ticks. Now let me go to the next one. So this is what it looks like. They're just kind of duplicated. You can kind of see where they look a little bit like, to me they look like little aliens, where they're like, I don't know if you can see, oh, there's a spotlight. Try and do spotlight. Can you see the red dot that I've got? Okay, so they're just kind of paired. Some of them, like this, it doesn't look paired. It's only because one is kind of stacked on top of the other one, but it will always replicate the same. So this will become 8 after that. Once it gets too big, the cell bursts, and then it will infect the next cell. So this one, I'm not going to just pick one of these to show you for the ID test. I'm going to leave all of these pictures together, only because I feel like some of them can tend to look like something else. So for this slide ID, I would be asking just what is the species of parasites that you're seeing here, and this is the Babesia species. The top 3 rows are actually found in the in cows and and then the bottom ones are dogs. So, but they look pretty similar.
Is it any tick or certain types of ticks that transmit this to the animals, or
I couldn't find any specific tick that caused it. It just said ticks. All ticks are bad. And then we got Mycoplasma haemophilus. He used to have a new name, or an old name. It was Hemobartonella felis. And then, you know, scientists, they decided to change the name. So now it's Mycoplasma haemophilus. And this is going to cause feline infectious hemolytic anemia. So what happens with this one is you get these little coccoid or rod-shaped rings that go on the periphery of the red blood cells. So the biggest part of it, let me see if I could draw them. I'm going to draw it in here. Make him red. So here's your red blood cell. If you're a cat, I'm going to make the parasite here. So the parasites are going to attach to the outside edges. So it can look like a Heinz body. But what I would do probably would be continue to look. If you're seeing more than one little dot on the periphery, then it is definitely Mycoplasma haemophilus. But if you throw this guy in EDTA, if you get a purple top tube, you draw this cat's blood, you suspect Mycoplasma haemophilus, throw it in that EDTA tube, what's going to happen is the EDTA is going to wash all of that off and you're not going to see anything. So you're going to look at the blood and you're like, oh, he's fine. This is totally normal cat. So if you're going to check for this, you want to pull the blood and check it immediately. Immediately do your smear and stain it. Otherwise, it's not going to show up. And the weird thing about this particular parasite is it's cyclical. So you may have a good day. This animal might be having a really great day. That the owner called up and he was like, oh, he's really like droopy and lethargic and stuff, and then he can't make the appointment for 2 days. He comes in 2 days and the animal is completely fine. So with this particular parasite, the body tries to regenerate the blood, and then what happens is they're fine. They appear completely fine. So then a couple days later, the parasite starts to replicate again, and then the animal's feeling really sick. So this one you get with fleas. So it's not a good one at all. No parasite is good, I guess. So with this one, to just make sure, you would probably have to do several blood samples, different times of the day, just to see what's going on with the animal. Because in the morning they might feel yucky, and then in the afternoon they feel great. Yeah. So here is Mycoplasma haemophilus. So you can kind of see where, if you didn't look around the whole slide, you might look at this one and go, oh, he's got a couple Heinz bodies. Yeah, he's got Heinz bodies, but he's also got these parasites that are sitting on the outside here. So the further you look, I mean, he's got some lymphocytes that are coming to the party as well. This one is kind of neat because you can actually see it sitting on the top part of the blood cell. And you know,
how do you know, looking at that that's a parasite? Like, it really just looks like Heinz bodies.
It does. So if you go over here where you've got the 2, this one has 3. There's 2 up here. So I would probably initially, I would, if I just saw like this part, like if I'm just in over here, I would go, oh, Heinz body anemia. That's what it is. But You're going to be looking through the whole smear, and you're going to want to take this multiple times a day. Yeah,
Okay.
Heinz bodies only have one. So these potentially could be Heinz bodies because he does have hemolytic anemia because of the parasite. So that hemoglobin could be detaching. But the further you look, you start to see that it's more than one little dot on the outside. And then if you're a dog, they can also get the same thing. But these guys get more rods. So they kind of join up and appear like little lines in there. So you would have to look kind of close. You have to have a really good microscope, but you can see how all the rods just kind of line up. So this is how it would appear in a dog versus this one, Mycoplasma hemocanus, is only for dogs, Valerie, and then Mycoplasma haemophilus is only for cats. And this is just tiny little coxoids that are just sitting on the periphery, whereas the dog kind of links up in chains and rods. Does that make sense? Okay. And then we got this one, Cytozone felis. So this one is super neat. This one actually has a particular tick that it likes. It likes the American dog tick, or if you remember from Lab Pro, Dermacenter variabilis. This guy is horrible. It is, if the animal gets this, if a domestic cat gets this, it'll cause fatal hemolytic anemia. It just destroys all of their blood. It also can start to affect their white blood cells. And then when the macrophages come in to try and clean it up, it actually spreads the disease. So you'll see it in macrophages, white blood cells, red blood cells, and it just destroys all of their blood. They don't survive long with this particular one. So the weird thing about it is if you have a wildcat, if you end up working at the zoo and you pull their blood, you would actually see cytozone felis naturally occurring in these wildcats, but it doesn't cause them any harm. So that's what innocuous means. It means it doesn't hurt them. So they can live their life just fine with it. It doesn't bother them. But if it's a domestic cat that you let go outside without any kind of tick prevention, it can get this. But this one just looks like little rings. It's just kind of irregular shaped little rings in there. It reminds me of pimento loaf. I don't know if you ever have eaten pimento loaf. That's what it reminds me of. That's cytozone felis. And that's it for that slide. Any questions on that PowerPoint? I think tomorrow we'll go back over all of this stuff because it was kind of a lot. And make sure you have all your pictures and things like that, and make sure you know all the shapes. So we'll go back and review all this stuff.
So the test is going to be over this and then the formulas?
Yes. Yeah, I think this is hematology part 2, and then some of that math. So all these little, like the dicryocytes, it'll have pictures of, and keratocytes. So those will all be on there. So the Edmodo test will strictly be ID and multiple choice, and I'm going to send the written portion in a different manner. So you would have a little bit longer time because I have to account for people that are only typing on their phone, and give them time to do that. So let's.
Portion timed?
What's that?
Is the written portion timed?
I'm not going to time that one. Mm-mm. You'll have
Okay.
24 hours to turn it in, but I'm not timing that one. I just don't think it's fair. Um, like I said, one of my students has to, I know only everything is done on her phone, so I think it would just, it'd be super mean. So I don't want to, I'm not a mean person, so usually. All right. So today in the other class, we started thrombocytes and coagulation. So if you don't have this PowerPoint up, um, it's not uh, it's not a super big deal. Most of the information is already on these slides. There's only a little bit of information that I'm going to be adding to it. So, and like I said, I'm also going to record, and you can come back later and check it out and make any notes that you need to make. All right. So this whole PowerPoint is just talking about like um, what is platelets and where do they come from and what do they do? Look at that. Super cute, right? I think you guys can draw on it too. And I did, I know I'm recording it, but I also made sure you guys had access to record on your own. So if you had wanted to, you could. All right, so let's talk about these platelets. Oh, I was like, did I do that? So let's talk about this birth of a platelet. Let me put in my typing here. So you do need a stimulus in order to make this. So you need, like we need, um, oh, now I forgot my words. Erythropoietin. For this one, you're going to need thrombopoietin. I think I'm going to make this in red so you can see it better. There we go. I think that's better, right? So there's also a whole bunch of cytokines that are required to create these. I don't need you to know them now because we have not talked about cytokines. Just know that in addition to thrombopoietin, you've got these cytokines kind of helping out. And this guy comes from your liver endothelial cells. It also comes from the kidney and other various sites in the body. So you don't need to know specifically the other sites. Just know that if you should go into liver failure or kidney failure or both, the body does store this in other areas. So you can, usually the spleen. So if you do experience any kind of bleeding, it can actually try and help you because the body is trying not to die. So it stores things and keeps it for just in case something goes wrong at a later time. But you need to start with this progenitor cell, which finally develops into a megakaryoblast. So that is your baby. That one has a single nucleus, super dark cytoplasm. So remember, blast is the baby because the baby just blasts into the world. I'll leave that up there for a second so you guys can get the notes. That sounded like a good stretch, whoever that was.
Is anyone else having problems with their internet today?
I am having a lot of problems.
Okay.
Yeah.
Yeah, mine's like extreme lag and it's
Yeah.
just freezing.
Mm-hmm.
Okay. I had to connect to a hotspot on my phone to pull it up on my computer, and it's just been a pain in the butt just today.
Yeah. I started having a problem yesterday at the meeting, like 3 o'clock. Miss Huff, it was kind of funny because it was like slow motion. because it was stuttering her, and she would like be like going across the screen. So I wasn't sure if it was on my end or her end, but it was weird. It was weird. All right, everybody good with this slide? Okay.
You said the cytokines, we don't need to know like what that is, but I'm just like, or did you say that?
Oh yeah, so you don't need to know the specific cytokines. We haven't gotten to those yet, so I'm not going to ask you for specific names. Just know that cytokines help out the thrombopoietin.
Is it like a hormone or like a cell?
They're kind of like hormones. So they're more associated with I don't want to say with white blood cells, but kind of with I guess you could say they kind of go along with white blood cells because like if you get really sick, they were actually just talking about the cytokine storms. I don't know if you've ever heard of cytokine storms. That some diseases are displaying, and the reason I bring that up is because they were actually talking about uh, this this pandemic that's going on, and the whole reason people are getting really sick is they have a cytokine storm. So what happens is the body is like, oh my gosh, this is a brand new virus. I don't know how to react to it. So the body just goes, here, take everything, and then it leaves you nothing. So cytokines just kind of, they're little helpers, but when the body is overwhelmed with infection or it encounters something that it doesn't know how to handle, you'll get this whole storm. It just, the body's like, here, take everything. I don't know what to do with that. Kind of perfect timing for the topic. All right, so let's go to the next one. Oh, why isn't it going? Okay. So then this little guy, he's going to start to develop and he's growing up. It's becoming mature. So he's going to turn into a mega karyocyte. And now he's got about 2 to 4 nuclei. And he's going to just keep growing and growing. He's replicating. He's getting bigger and bigger until you finally have your mega karyocyte. And he's super huge. This is the one that we were talking about the other day, where you've got the blood vessel, like so. And then here, let's turn it red. And then he's growing on the inside here, like so. I guess this would be the skin. And then anything that, I'm going to make my blood blue, just so you know. Blue. So here's my blood vessel. He's running right alongside of this, and he's going to cut it off. And these little pieces are going to break off. So he gets sheared off. So this guy here himself, he's really big, but all those cytoplasms are extending and getting cut off. All right. Come on. There we go. So all those tiny little guys that are getting sheared off, they're not platelets yet. They still have a little bit of growing up to do. So we call them proplatelets. And they're going to keep breaking down just further and further. While they're in circulation, they're bumping into things and they're breaking into pieces. And I super love this picture on the side. How they got this image, I don't know, but it's so amazing. So this is a tiny little blood vessel that is broken, and all of the platelets are surrounding it. It does look like Nickelodeon slime. It is so cool. Like some of these pictures that I have found, like amazing. Like I want, like, you know, Santa to bring me a electron microscope or something. Okay, let's undo this. All right, so this is another really cool picture, a couple pictures. The resting platelets and the activated platelets. So these little resting platelets just look like little discs. They're not doing anything. And then if they just feel like there's any bleeding or they think there's any bleeding, they become activated. So they develop the pseudopodia and start crawling towards the site of damage. Super cool. They're so smart. This is just some fun facts. So all those megakaryocytes that are in that blood vessel, they can make about 1,000 to 3,000 platelets during their whole lifetime. And it all depends on the size of the animal. If you have any reserve platelets, the spleen kind of holds them. It's kind of the holding zone. And then if you start bleeding or you're undergoing any kind of surgery, your sympathetic nervous system is going to contract your spleen and it's going to release them. And you can't keep all of your platelets for your whole life. So anything that's old or used, phagocytosis is going to come through. It's going to clean them all up, send them to the spleen and liver, send all the pieces so they can go ahead and reuse the parts. So this picture here, there will be a part of the homework test where you have to tell me the developmental thrombopoiesis order. And I super love this picture, but it is missing one thing, but we'll get there. So here's your hemocytoblast. Let me do my little thing here. Looking for the spotlight. So here's your hemocytoblast. You can also call it a stem cell. I will let you do either one, whichever one works for you. But then this guy turns into a megakaryoblast. And then you got your pro-megakaryocytes. And then this picture I super love because this is the megakaryocyte. So if you imagine him inside of those blood vessels are being sheared off. Where's my draw thing? So if that blood vessel is like running right here, this is what's getting sheared off. All these tiny little pieces, which is pretty cool. They are forgetting one thing right in the middle here. I'm going to use my typer because it's hard to draw this. They are forgetting proplatelets. They forgot it, but that's okay. We fixed it. And then finally you have your platelets. So it's like a 6-step process in order to get a platelet. Ugh, my dog. I gave her a treat yesterday and she's sleeping by me and she has the worst gas in the world. It's really bad.
As I made the mistake and giving mine boiled eggs yesterday, and there was 2 of them laying
Oh.
beside.
Keeping you warm. Okay, everybody got that whole cascade there? Okay. All right. So the next few slides just show how everything works and how everything's put together and the order everything goes in. This is another super cool picture that I found that it was at the Cancer Institute. I even put they have a whole bunch of really public domain free pictures for you to look at. I just thought it was so neat that they got these 3 friends all lined up. They got the red blood cell activated platelets and a lymphocyte all in one picture. Just amazing. Like, blows my mind. Blows my mind. All right. So we're going to talk about primary hemostasis first. Primary hemostasis is basically your body saying, hey, I don't want to fall apart. I don't want to bleed out. If you damage a pipe, you need to fix it. Sometimes it happens outwardly, if you scrape your knee, fall, and hurt yourself. Other times it's just something like I bump my arm, bump my elbow, I've got a bruise, so that it can happen under the surface of the skin. But your body doesn't want to bleed. It wants to stop. It wants to keep this hemostasis so everything is working in good order. This is a kind of neat picture to just kind of show some of the platelets coming together to try and form this plug. Did you have a question, Shatoya? I don't want to go too fast. It's okay. It's okay. I just wanted to make sure. Okay, so that's primary hemostasis. The body's like, whoa, they're broken. I need to fix them. So what I'm going to do is I usually write this stuff up on the board, but I'm going to go ahead and put it down here because I want you to keep the steps straight in your mind while we're going from slide to slide. So the very first thing that is going to happen when you hurt yourself is you're going to have vasoconstriction. So blood vessels are getting smaller. Shrink. Because your body is like, nope, you can't go anywhere, and it's trying to hold that blood in. So the muscles in those blood vessel walls just kind of go, no, don't leave me. And then the second thing that's going to happen is you're going to get a platelet, where's that? Oh, I lost my page. The platelet plug. Make sure I'm on giving you the right words. Sorry. Yes, platelet plug. I second guess myself sometimes. Platelet plug. So that's the same thing that would go in this space if you have your PowerPoint. Platelet plug. So this platelet plug is just temporary. If you've ever gotten a scrape or something and you just kind of get it to stop bleeding for a minute and then don't think about it and you bump your hand again and it just reopens, that's because you've kind of knocked off the plug. I like to think of it sounds like kind of gross, but if you chew some bubble gum and then you stick it to a wall and it'll stay there unless you go flick it and knock it off the wall. So that's kind of like a platelet plug. So it'll plug the hole for a minute until it gets knocked off. So I'm gonna leave this running tally on the bottom going so you can have that. So the next thing that's going to happen is they need to be able to stick. They need to stick there. So you're going to need to have adhesion. So they're just floating around the blood. Floating around the blood. They see a torn wall or blood of the blood vessel, and they just come and they stick to it. I'm like touching my wall here. I don't know if you can see me. I'm stuck to the wall now. So all of these blood vessels, they have collagen inside of them. So platelets love collagen. It's like a good snack for them. So once this wall gets torn, collagen gets released and the platelets are like, ah. So they come by, they're attracted to this collagen, and they move quickly over there. But now, in order for them to stick, they need glue. And I know in behavior, we started talking about some of the animals that can get von Willebrand's disease. So von Willebrand's is a super, super important factor for these guys to attach to certain platelets. So they've got little receptors on their surfaces, and they need this von Willebrand's factor. He is the glue that holds everything together. And you store this factor in all the endothelial cells lining. They also get released along with the collagen. So if you don't have any von Willebrand's factor coming out, they can't stick. They can't stick at all. And there's some breeds that have a problem with that. I don't know, I keep touching my wall. We're pretending this is the blood vessel. So von Willebrand's super important. I didn't want that. Well, I was trying to make more lines. There we go. Come on. There we go. Then the next thing that's my computer's lagging a little bit. I apologize. The next thing that has to happen is once they detect that collagen, they're activated. So they're like, whoa, it's like me with Doritos, like, Doritos. My fingers go out like this, and I'm going to call all my friends and be like, there's Doritos. So that's what they're doing. So they're activated and they are secreting. So the secretion allows them to go ahead and call more platelets to the party. So activated, they've developed their pseudopodia, and as they're activating, they're secreting all these proteins to call more platelets in. It's just like a chemical signal. We got 5 steps. And then finally, we've got aggregation. So now everybody has been called and they've come to the party, and we've got aggregation. So now they're all kind of clustered around this broken hole in the blood vessel, and they're sticking together. They're doing a whole bunch of things, but this is still temporary. I could bump this hole again, and it's just going to fall apart. So what you absolutely need is a fibrin clot. So this whole process, it's fixing the plug, but if you don't have fibrin, it's not going to work. I personally like to think of fibrin like if you ever looked at duct tape, and you know how it's kind of like interwoven little, almost like a fabric type of thing. That's kind of what fibrin is. So you've got the little gum stick thing here, and then if I took some duct tape and I put it around it, that would really seal it. That's not going to go anywhere. So you definitely need that fibrin clot. So I'm going to add that in there. Fibrin. Oop. Clot. I'm going to leave those 7 steps down there on the bottom for you. All right, so now we got this good, strong patch. And this is where the whole clotting cascade starts to come into play. Oop. I just don't want to make sure, I want to make sure I'm not going over our time. So we've got 12 clotting factors, and they all are named with Roman numerals. I've taught this enough times to know that some school districts do not teach Roman numerals. Our book refers to them in Roman numerals, so I've put them here. As far as our test is concerned, I am allowing everybody to use regular people numbers, like 1, 2, 3, 4, 5, if you're not familiar with the Roman numerals. So I don't want you to stress. Yes, it is common in Dobermans, for sure. Melissa remembered. So all these guys are working together, but the body also needs to get rid of it. So some of these factors are going to go ahead and help break it up, because if you keep all of your clots, you're going to have a huge problem. So there are some animals that have a problem with getting rid of clots. There's humans that have problems getting rid of clots. So we're going to talk about each of these little factors. I just threw this one up here just to review, which is everything that I've written on the bottom here. We got vasoconstriction, platelets are making a plug, they're adhering, activating, secreting, aggregating, and then finally fibrin clot. Now we got to talk about secondary hemostasis. So now this is how we're creating that duct tape. How are we making this fibrin clot? He's got a best friend named thrombin. Those two work together super, super well. And what he's going to do is they are going to stabilize that plug, so we don't have to worry about any kind of hemorrhaging, because we know that that clot is not stable. So this whole coagulation cascade really helps stabilize it and enhance the primary hemostasis. And of course, all of this is going to be super dependent on where the injury is. If it's a bendy joint, you're going to probably need more fibrin, because it is an area where you're constantly moving, and it's going to constantly be pushing that off, and it's going to take longer to heal. Whereas if it's something on the surface, it would be much easier to heal. So I think we talked a little bit about the clotting cascade a while ago, not in detail, but this is the part when I was a student that really perplexed me. So the book goes into great detail. The Lab Pro book goes into great detail about this. The A&P book as well, and Big Bertha goes into a lot of detail. I wanted to make sure that when I found out I was teaching this, I needed to figure out a way to explain this in a more easy digestible way to kind of simplify, but without taking out any of the meat. So I need you to know that there's 13 clotting factors. If you're looking at the book, they are, hang on a second. Admit. They are going to assume that one of them is being activated. So you're going to see number 7 and then 7A, which will then lead down to 3, and then 3A, which will lead down to 10, and then 10A. I feel personally teaching that it can be a little redundant and can be a little excessive to try and understand. So I'm removing all of the numbers that have the A. We're just going to assume that this animal is normal and their clotting functions are normal, and that when one is activated, the next one is going to come right after it. So there's a bunch of clotting proteins, lots of factors, but we are only going to look at the ones that are clinically significant and the ones we can actually test for. And when we get back, we're going to do we're going to have lab after lab after lab, and it's going to be amazing. But we're going to do some coagulation tests. This one, I think I have 2 or 3 labs set up for us, and it's going to be so great. It's going to be great. All right. So what you need to know about this whole pathway. I'm waiting for my cuckoo clock to stop cooking. Yeah. Sorry. I guess it's 11 o'clock. I don't know if you guys can hear it. Can you hear it? Okay. All right. So you got 2 pathways. You've got the intrinsic pathway and you've got the extrinsic pathway. So I like to personally draw it out like, no, I want to do this one, like this. It's like a sideways Y, like so. That'll make sense in a minute. So intrinsic is on this side, and then extrinsic is over here. So the intrinsic pathway happens because we've directly affected that blood vessel. We've exposed the collagen, the platelets are circulating, they're going straight to it. A good example of this one would be doing a needle stick into a patient. I've directly affected and damaged that blood vessel, and now we have the intrinsic pathway that's activated. The extrinsic pathway, pretty much anything else that can cause bleeding. Maybe the patient was hypoxic, maybe they're going through some sort of infection or sepsis, or they have cancer, inflammation, extreme like cases of vomiting where they're getting like petechial hemorrhaging, just the pressure of the vomiting has caused this bleeding to happen. So extrinsic pathway is everything else, something that is not directly related to that blood vessel, but it caused it to burst anyways. So what happens here is, let me put my line back up here. So you've got these two pathways that are right here. But down here is the common pathway. Oh, that's a line. So this is common. So you've got numbers over here, and then numbers over here. But intrinsic and extrinsic are going to meet, and then they're both going to follow the same pathway. They took there's two forks in the road, but then they eventually end up down the same pathway. And the common players for these are thrombin and fibrin. They are best friends, and when you see one, you should see the other. I'm going to leave that up there. I don't think it's going to interfere with the other slide.
So these are always at where the bifurcation is going to be at?
Yes, yeah. So once you get to number 10, that's where the common pathway comes into play. But it's science, so they don't like to go in numerical order, which is awesome. So let me just give you these are all their names, 1 to 13. You've got fibrinogen, prothrombin, you've got tissue factor, calcium, proacelerin, acelerin, proconvertin. Number 8 is a very common one that if they have a bleeding or coagulation problem, the antihemophilic factor A. And then there's hemophilia type B, which is, they are missing number 9, which is the Christmas factor. Then you got Stewart-Prower, plasma thromboplastin, Hagman, and then finally 13 is your stabilizing factor of fibrin. So that one will always be at the very end. But all of these guys are plugged into different areas of these pathways. I'll give you a second. I don't know if you guys are writing those down or not. We'll give you a moment. Everybody good with that one? So the reason I put acelerin in red is because he doesn't exist. He exists, but he doesn't exist within the clotting cascade. So the scientists hundreds of years ago that formulated and sought to understand what the clotting cascade was, found it, named it, put it, and we're like, oh wait, it doesn't have any impact on this clotting cascade at all. So he doesn't show up on our little Y here at all. Proacelerin does, but acelerin does not. So they just never removed him from as a clotting factor, but he has no effect at all on this, which is strange. So this is how the book displays it. I know when I was a student, I found this to be a bit overwhelming. I don't know how you guys feel about it. If this works for you, if you like it, you most definitely can use it. I feel like it can be a little much, but you can see here they started with 12. Once the surface is damaged, then it's activated, so they add the A, which hits number 11, which gets activated here, which activates 9, and so forth and so on, until you get to this common pathway down here, which starts at 10. So what I did to help myself understand it better and to better explain it to you is I broke it down like this. So you've got your intrinsic pathway. I'm going to put my little text back on drawing. So I like to think of it like this. 3, 4. So I've got 12 over here, which goes to 11, which goes to 9, which goes to 8. Here's the start of my common pathway. Ooh, that's a really big circle. Here's 10. I'm going to put, it's hard to draw with a mouse. 10. And then 5 and 4 go together. So as soon as 5 is released, these two are friends, 5 and 4. And then you got 2, and then you got 1. And at the very bottom, you need that fibrin plug. You got 13. I know it's a little sloppy, but hopefully you can all read that okay. So here in red, if you have it printed in color or on your PowerPoint, this is the common pathway. So this one is not going to change once we get to the extrinsic side. So let's go to, I'm going to leave these little guys up. So here is everything else. So this is your extrinsic pathway. Go back to my pen. So you're going to start with up here, number 7. And then it's going to go to 3. And then it's going to follow the same pathway. 10, 5 plus 4, 2, 1, 13. And I do have a Word worksheet that I will send to you guys. So you can have this, and I will shoot that to you this afternoon or later tonight. That way you can draw it out much prettier than I have done here. So here's your common pathway. I wanted to just put that on its own slide so you know who's the common players. And that's it. That is it. So for these, I do have, where is it? Let me go back. I have this, I'll ask questions like clotting factor number 8 is, and then you would have, 4 choices to choose from. So that would be more of a multiple choice. When I'm doing the written portion, I do like to ask for the order, and for the test, you can use like regular numbers. You don't have to use the Roman numerals. So you could just list 12, 11, 9, 8, 10, and so forth. Does that make sense for everybody? Cool. Did you? What's that?
I just had one question.
Yeah.
So, could you go back to the clotting factors, like all of them?
This
Sorry.
one?
Yes.
Yeah.
I was just confused because it kind of just, sorry, everything just jumps around. And is it because like on one side there's only certain factors and the other factors?
Yeah, so science doesn't make it easy for us. The book lists them 1 through 13, and to give us just the names of them. But when you actually put it into play, they don't work in numerical order. So they kind of jump around. So 12 will activate 11, and then it skips 10, goes to 9, 8, back to 10. So it can be a little difficult to understand. That's why I felt like the way I learned it was it took us like a week. We spent like a week on this. We were expected to label everything, and then you had to have the activation factors, and then we also started putting into what if they don't have number 7, what happens then. I don't want to do that with you guys. I just want you to be able to identify who number 3 is. Which one of these, number 6 doesn't really exist at all, doesn't bear any influence on the clotting cascade. And then as far as, that's why I like the Y pattern, just so you can kind of lay it out and see where everybody is on the track.
Sorry, and then when you say that, like, who number 3 is, do you mean like if you say like what clotting factor is number 3, we need to put tissue factor?
Yeah, yeah. And then I would have that as like, I usually do those as multiple choice questions. Geneva, we are going to learn about a few of them. She asked if we're going to learn what each one of the factors does specifically. Only a few of them. We're going to talk a little bit more in depth about the antihemophiliac factors and the problems if you're missing. We're really going to go into detail later about fibrin. But we won't do that tomorrow. I don't want to do that tomorrow. We'll probably do that on Friday, and we'll get into part 2. So I'll make sure I send that PowerPoint to you unless you already have it. We'll get into greater detail about that. Tomorrow I want to just focus on, let's review for that test, and then get you ready for that one. Sound good? All right. Did anybody else have any other questions about this PowerPoint? No? Okay.
I do have a question, but it's not about the power.
Okay.
So are we still picking up on our second part of the semester for pharmacology, and you will be instructing that online as well, or are we going to be delayed with that?
That I'm not sure of. I know as much as you do. I think we are going back on the 30th is what they are planning. And he told us that it's a very fluid situation. So they're working along with, I can't think of the letters now, but it's the college, whatever, the Texas, who's ever over the colleges, to make sure that everybody's safe. And if we're still on a quarantine notice, we're going to have to possibly push everything back a little bit. But at this point, they're hoping that by the 30th, everything is good. Are you guys all good?
You said we'll go over this again when we review, right? Before this, we take this.
Yeah, absolutely. And I mentioned it yesterday in our meeting. I said without being able to do the labs, I feel like we're getting through the PowerPoints. Not that we're getting through them faster than we are in class, but a little bit because, you know, I'm not standing up in front, like drawing on the board, and you don't have access to always ask questions. So I think we need to slow things down a little bit before we get way too ahead of ourselves, and then we get back to school on the 30th and we're like, well, we're done, so don't have anything to do. But I can always find labs and stuff. It'll be good. But yeah, we're definitely going to slow things down a little bit. All right, I will let you guys go. Get yourselves a little break before your next class. I'm going to stop recording this and I will